So my tumors were found on a routine screening mammogram. It was very difficult to learn that I had breast cancer. And one of my first thoughts was, I know too much. I've been involved in the care of oncology patients pretty much my whole life for over 30 years. And it was quite an experience to realize I was going to be on the other side with my journey. I had too many facts and figures in my head, and I had to realize that I was an individual and this would be my journey. And I could only control so much of that, but I attempted to control what I could control, which was always my attitude and how I conducted myself. The first few months were actually pretty rough emotionally. I felt like I was on an emotional roller coaster, and it was like I was grieving. You know, one example was my diagnosis hit me like a ton of bricks when I was in my consultation with Dr. Kretzler at Radiation, and her staff were just so kind to me, handed me Kleenexes, and really helped me work through that piece of the roller coaster. I felt initially like I had no control, and I was, I was pretty scared, to be honest. And then I had a biopsy done, and Dr. Obi was kind enough to call me with those results personally, and we talked through preliminarily, what the plan would be. Then fast forward to chemotherapy with Dr. Malik. Each and every time, we would go head to toe through my symptoms.
I feel like what that taught me is that we need to be supportive of each other and our own vulnerabilities. When someone is diagnosed with something like cancer, it inserts itself in our lives without warning. And to be able to help someone and guide them through uncertainty. So when you give someone a roadmap of what to expect, then the anxiety goes down, because the biggest issue is fear of the unknown or what to expect. So when we can tell them that this is what's the plan, and we've already discussed it and we all agree on the plan, then that cohesive answer gives a lot of reassurance to our patients.
It actually surprised me a little bit that I was treated as an individual and not as a tumor or a case. And this was true from every staff member I interacted with. I felt like I was truly receiving personalized medicine. This journey has definitely made me a better oncology pharmacist. I can see it from a whole new light of how patients should be treated, and I am already trying to reach out to other folks. And I would love to talk to anyone who is starting this journey. If you just need somebody to yell at, call me up. I will be there.